Adapting the environment. Part 1. Visual impairments. Our environment in most cases makes it more difficult for people with impaired vision. To make it more accessible, we have to take into account many factors, the most important of which are: the first place, colors, use of colors. We need to use colors standing opposite each other because those give the best contrast. Opposite colors give the best contrast, but we also need to consider how bright and clear these colors are. The brighter the colors, the greater the contrast. Some important recommendations when using colors and contrasts. It is important to have a contrast between door handles and the doors themselves, the doors and the walls, door frames and walls, auxiliary backrests and handles, walls and floor. How to measure color strength and contrast. We should use light reflectance value measurement, and the formula for contrast is given as the LRV of the brighter zone minus the LRV of the darker one times 100 divided by the LRV of the brighter zone. LRV equal to 0 is literally black, and LRV equal to 100 is white. We are searching for color combinations that have a contrast value of at least 70. Designations and signs. When placing signs, it is necessary to take into account their size, the contrast again, and how easily they can be understood. It is important where they are placed so that they can be easily distinguished. Eye level would be perfect for people with visual impairments. Lighting. Different visual conditions require different lighting for people to see as well as possible. Some people need more light, others need less light. Always ask what the preferred lighting is for each member of the group. Glare and mirrors can cause discomfort for people with certain vision conditions. Mirrors can be really confusing, and frameless ones create a false impression of what is in front of us, and they can be actually dangerous. Different types of surfaces can help people with vision loss to orient themselves. Whether it's grass, additional pavement, and other tactile elements on the pavement. Anything can be of help to a person with visual impairment to navigate. Noise can be distracting, disorienting, and confusing for people with vision loss. Extraneous objects, or also known as clutter, too many belongings, objects or elements in the environment, or even on a sheet of paper, make it difficult for people with impaired vision to find their way. Part 2. Physical disabilities. Usually when we think of people with physical disabilities, the first thing that comes to mind is the icon of a person in a wheelchair. This is the most common notion connected with them. Actually, physical disabilities are many more and different in type. They can be related to both limited physical mobility and reduced dexterity. In general, people with physical disabilities have difficulty moving and performing various movements. For example, raising a hand, standing, sitting, walking, picking up. Next, the damage can be either to a specific part of the body, for example, a leg, or to the whole body. Another distinction we can make is related to the duration of the disability. It can be short-term, temporary, long-term, and permanent. Such injuries are widespread and can usually be related to various accidents. In addition to this type of disability, some are genetic or related to diseases that lead to physical disabilities. The main problems of people with physical disabilities are their movement in an urban environment, access to public buildings and public transport when the latter haven't been made accessible. There are various solutions to facilitate them. When we talk about getting around in an urban environment, we need to take care of obstacle-free routes, lowered curbs of the sidewalks, wider and level sidewalks for wheelchairs, accessible push buttons for traffic lights, non-slippery stairs and handrails, specially designated parking spaces. Reducing the speed limits in densely populated areas would also be really helpful. For public places such as shops, restaurants, hotels, again, we need access ramps, elevators, escalators, large doors, secured stairs, accessible restrooms, and parking spaces. For public transport, we need access ramps, elevators, escalators, large doors, secured stairs, lowered stop buttons for wheelchair users, and visual and audio information about the stops so that the riders can easily know when they need to prepare to get off the train or the bus. providing information at the bus stop or at the public transportation stop when an accessible vehicle is going to arrive is really useful for people with mobility problems. Part 3, intellectual disabilities. When we talk about intellectual disabilities, we need to know what they are and how they are defined. The definition for them is as follows. An intellectual disability is a term used when there are limits to a person's ability to learn at an expected level and function in daily life. People with similar disabilities have problems with problem thinking, conceptualizing, communicating, and making decisions. In order for them to feel included and have free access, it is necessary to provide them with an environment in which they feel safe and protected. In public places such as shops, restaurants, hotels, it is necessary to have accessible and easy-to-read information that people with intellectual disabilities can easily understand and use. This can be achieved by using short sentences without ambiguous expressions, as well as by using examples. For easy orientation, especially in larger complexes, maps and photos of parts of the building come in handy. Separately, pictograms are a great way for visitors with intellectual disabilities to navigate. Safe stairs for the free movement of this type of visitors. It is necessary that the stairs be provided with appropriate lighting and contrasting and anti-slip edges. In public transport, the use of audiovisual presentation of information along the route is being used with greater frequency. Work can also be done to simplify the actions required of passengers and those with intellectual disabilities, in particular to facilitate their movement.